Doctors are taught how to be doctors, right? And how to treat patients. And nurses, they're taught how to be nurses and how to care for patients. But you and I, we are never taught how to actually be a patient and how to navigate the healthcare system. This episode was not planned, so I'm sorry if it seems a little bit scattered, but we decided to keep it in as a standalone episode because we felt like it's important and that it's a conversation that needs to happen more often. So in this episode, which is certainly interesting, we're going to talk about consumer protection, so the No Surprises Act, and price transparency, and how you really should be treating healthcare like a business, even though that's an unpopular opinion. And we're also going to talk about the current atmosphere with healthcare fraud and regulations. Healthcare costs are some of the most significant expenses that you'll probably ever have in your lifetime. And there is just not enough conversation out there on healthcare literacy. So we hope that this helps and that you find some benefit from it. Thank you for watching, or thank you for listening. All right, so welcome to the Disturbingly Interesting podcast, everyone. My name is Megan. With me is Ben. And we're going to talk about superhumans, so people who have survived the impossible. We'll start with some stories of survival. Actually, we're not going to start with stories of survival. I forgot. First, we're going to talk about the American healthcare system, which is both disturbing and interesting, but also a request. So, Vicky, this one is for you. Asked for a short reel or like a clippable clip of information so that she can share it. So I will do my best to do this. So I was making an update video for the Haunted Grove members. And in it, I had seen this TikTok earlier in the day from a woman named Dr. Elizabeth Potter. You might have seen, she kind of went viral because she was the surgeon who was interrupted mid-surgery by United Healthcare to talk about her patient who was currently on the table. It was just insane. They were essentially trying to justify her surgery.
Plastic surgeons clash when insurance company touches a nerve.
So since this whole thing, Dr. Potter has kind of went on a crusade to kind of like expose insurance. That might not be the right word. Really just to kind of make the system better. So she was talking about how she saved one of her patients like thousands of dollars because she had called the price transparency line of the hospital that they were supposed to do the surgery at. And they said it was going to cost some ridiculous amount of money. So she had said, well, I can do it at my surgery center for a fraction of the cost. She's like, so I saved my patient a bunch of money. But the comment section was just full of people essentially saying, what the hell is price transparency? Like, what are you talking about? Hospitals don't just give you that information. So anyway, I made this video for them because in my day job, I work in the back rooms of healthcare in the compliance department. So part of our job is to keep our organization compliant with all of those rules and regulations. Contrary to popular belief, healthcare is very regulated. And my area of expertise is Medicare. It's Medicare regulatory policy. And I just happen to be a subject matter expert in this area. It's called the No Surprises Act. And I forget, because I live this stuff every day, that not everybody knows this information. So for anyone who is interested, in 2021, as part of the Consolidated Appropriations Act, there was something called the No Surprises Act, which was put into place, and it's consumer protections from unexpected or surprise medical bills. And there is a lot to the No Surprises Act, but for simplicity, there's kind of three major components to it. And this is a federal rule, so this is applicable to everyone. There are also state rules as well. But the first one, if you go to the emergency room, because maybe like you injured your eyeball or something, and you need some kind of like an eyeball specialist, the ER, they have to inform you first and get written consent if that specialist is out of network. So they can't just bring anybody in that they want. If that person is out of your network for your insurance, then they need to make sure that you're okay with that. And then you have to actually have a written consent to do that. The other part of that is kind of like a 1A is that your insurance, so if you have commercial insurance, so like Blue Cross, Blue Shield, Cigna, that type of stuff, they can no longer balance bill you for services. So if you go into, I don't know, maybe you had a follow-up appointment and you needed to have some kind of weird thing done to that eye and you made the appointment, it's in network, wherever you're going is in network, you did all the things you were supposed to do, but you go in and you have this procedure done and the doctor, for whatever reason, ends up being out of network. They would then charge the hospital the out-of-network rate. And the hospital's only going to get paid what insurance is going to cover. And then essentially that physician could bill the patient for the rest of it. So balance billing. They're not allowed to do that anymore. So if you get a crazy bill, I would question it. Part 2 to that is good faith estimates. If you have a planned or scheduled office visit or procedure, if you're either self-pay or have no insurance, so it's only for self-pay or no insurance, the provider is required to give you what's called a good faith estimate of services. And that estimate has to be within $400 of the billed amount. So whatever your bill is you get in the mail, the estimate has to be within $400 of that. If it is not within $400 of that, then you can dispute that bill and you may not have to pay it. So that really works for if you have a scheduled service, like if you have an office visit, and you're like, my eyeball hurts. So you schedule an office visit, you go see your provider. They say, okay, for this eyeball visit, this is what's going to cost you. If that's what you go in for, great. If you're in there and you say, oh yeah, by the way, my foot also hurts, and then they do an extra exam, that's not covered in that because they wouldn't have known about that at scheduling. But anything that they would have known about at scheduling has to be in that good faith estimate, and then it has to be within $400 of that.
Okay.
And then the third one is price transparency. So every hospital that participates in the Medicare program, which is essentially all of them, any hospital that receives federal funding participates in the program, they have to have listed on their public website a list of 300 of their shoppable services and their costs. So shoppable services are like their most common services, like an x-ray or office visit or something. And then with that, they also have to have what's called a machine readable file, which is exactly what it sounds like. But they are required to have a link to that at the footer of their website. So if you ever go to your favorite hospital website, you go all the way down to the bottom where they always put that contact information or like about us or here's our social media links and stuff like that. They are required to have a hyperlink that says price transparency. And then that is to take you to a list where you can then get information on how much things cost at your hospital.
2026 file.
If they don't have that, they are not in compliance. A lot of hospitals are using it's like a price estimator tool, I think it's called, where if you go in and it'll tell you, you can put in your insurance information and then it will tell you what you're actually got, what's covered and what's not covered.
Mm-hmm.
It's called the minimum negotiated and maximum negotiated amounts. Because the hospital negotiates those prices with your insurance company.
Mm-hmm.
So when you get a bill for a $500 Band-Aid, it's because that's what they agreed upon. That's how much they agreed the Band-Aid would cost. But you can also get the cash price. So the cash price is typically cheaper than the insurance price. But if you do put your insurance information in there to get that price information, they can't use that. Like it's only for looking that up.
Okay. I really hope other hospital spreadsheets are more user-friendly than the one by me.
They are supposed to be, so CMS, Medicare, is currently auditing all of these at the hospitals. They are supposed to be, humans are supposed to be able to read them, which I think is crazy because they ask for a machine readable file. So like humans aren't supposed to be able to read a machine readable file. So if you can't get to it and if you can't understand it, chances are CMS is going to ding them for non-compliance.
I mean, like I can find it and like I could probably trudge through it. I just think it would take some time to figure out. And I feel like that's counterproductive if this is supposed to just be like, these are our prices for things.
Yeah. It's crazy to me because this stuff was put out in 2021.
Really?
This is a part of the Consolidated Appropriations Act of 2021. And nobody knows about it, which is absolutely insane to me. Like you have the ability to look at the prices of all the shit at your hospital and what your insurance company will cover and what they won't cover to a point. Obviously not everything is listed in there, but a good portion of it. And they don't tell anybody about their consumer protections. Like there's actually a ton of consumer protections when it comes to healthcare. And that's what, I mean, if anybody's out there asking themselves, Megan, why are you talking about this on Disturbingly Interesting? Because it's interesting and it is disturbing because nobody knows about it and no one's going to tell you. No one is going to tell you that information, even though all of it is public. So yeah,
I never would have thought to even look for that.
And it can be crazy. I mean, like depending on the service, you might just have it could be significantly cheaper to just do the cash option than running it through insurance.
Click here to access our price estimate.
Yeah. That's that tool, the price estimate tool.
Okay, so let's say I'm going in for a birth.
That's a spendy one.
C-section. Let's say I think I have United Healthcare. $12,000 total amount. So if I self-pay without insurance, it cost me $12,000.
But if you went and looked at a different hospital, it would be a different price. So you can literally shop for the best price.
Why has no one consolidated all of these into like a single tool? Kind of like that one website for like searching for flights, Expedia.
I don't know. Maybe that's the thing. It's like I said, it's crazy to me. I like in my own real life, like, I mean, people ask me about this stuff all the time, which is awesome. I love answering it. But I've had conversations with people. They're like, oh my gosh, in between jobs, they don't have insurance. They had something happen to them. They went in and ended up with this crazy bill. And they're like, I have no idea how I got this. Like, well, did you get a good faith estimate? Like, no, they didn't give me one. And it's like, okay, well, had you known that you were supposed to get one, you would have been able to dispute that and essentially get the bill waived because it's the hospital's responsibility.
Right.
But nobody tells you. And they're supposed to have signs posted, like, you know, you're supposed to have signs posted everywhere that says, hey, here's a good faith estimate, or you know, we're not going to like pick doctors that are out of network. And like I said, there is so much to the No Surprises Act. It actually, I'm not going to get nerdy about this, we'll talk about it, but like it fundamentally changed the way that we do business in healthcare.
Yet nobody knows about it. That's actually, so I have some stupid questions about healthcare, particularly insurance. What is the point of having in-network versus out-network? If the insurance company is just footing a bill, why don't they just foot that bill across the board?
It's, well, I mean, there's a lot. Essentially, it comes down to those negotiated prices.
Okay.
So if it's in network, it means that those prices that they've agreed to that.
Okay.
They have, they're called there's de-identified minimums and de-identified maximums. And so it's like, this is the least amount that they'll have the same, if they've got contracts with like, we'll say 100 different insurance companies, they could have 100 different prices for the same service. And it could be anywhere from $5 to $5,000. I mean, like huge gaps. But yeah, it's essentially, it is because of those contracted prices.
Are those contracted prices always, like you were saying, like sometimes it's cheaper just to pay cash?
Mm-hmm.
So what's stopping like a new insurance company from coming through and just only using these like price negotiation, like these price checker tools, and just forcing people to use the cheapest option near them for all things? And then of course, like at the hospital level to compete on pricing.
Well, that was the whole purpose of this, was to get hospitals to have to compete, because the thought process behind it was, if we are transparent with all of this stuff, well, I'm sorry, not when I say we, it's not we. If we, the government, force the hospitals to be transparent with all this information, then it would force them to have reasonable prices, because you could literally shop down the street for a better deal, which in theory, that's true, but it doesn't work if nobody knows about it.
Right.
Which, if I put on my conspiracy theory hat, I would say is the point. The reason you don't know about it.
I feel like there is it feels intentional that we don't know about this.
Yeah. But I always, I tell everybody about it. Like I said, it's public information. It's not proprietary in any way. It was a law that was passed, and it is actual law. Like, they have to do it. And
I'm gonna tell everybody I know now.
Yeah. CMS will side with the patient almost every single time, because it's cheaper than siding with the hospital. And chances are the hospital has made a mistake. Like, there's so many rules and it's so highly regulated that the chances that somebody made an error are pretty good. But I always tell people, like, this might be an unpopular opinion, but we need to start treating healthcare like a business, because that's exactly what it is.
Yeah.
I was talking to somebody. I said, well, if I wanted to paint my house and I wasn't really sure like what color I wanted, but I'm, maybe a blue, I don't know. And I hire a house painter and I say, hey, I want my house painted. I'm not really sure. I'm coming to you for your expertise. I'm thinking blue, but what do you think? And the house painter says pink. I'm like, well, I don't really like pink. Too bad. It's pink. It has to be pink. If not, we'll start with pink. And then if you don't like it, we can come back and paint it blue for an additional fee. Well, I don't really want a pink house, so thank you, painter, for your services. I will go elsewhere and I will find a new painter to do it. But essentially it is, you have the right to refuse treatment. We also have rights as patients. You have the right to refuse treatment. And if you don't agree with them, you can say, no, I don't agree. I don't want to take that. I don't want to do that. I don't need that exam. Or why am I having to have that exam? I'm a pain in the ass to these people too, because when I go in for my stuff, I went in for an ultrasound on my thyroid, and the doctor goes, well, we can do an MRI. And I'm like, you don't sound super convinced about it. And she's like, well, it's right on the cusp. I don't think it's that big of a deal. And I'm like, okay, well, are you worried about it? No. Well, if you're not worried about it, I'm not worried about it. Let's not do this MRI. Like, what's the point of doing it? And she's like, yeah, okay, no need. Perfect. Save myself a couple grand.
Oh, I feel like healthcare has been so complicated that it almost requires a degree or years working in it to understand how to navigate it.
It is. It's a skill. I mean, you have to learn how to be a patient, and nobody teaches you how to be a patient.
No.
Right. So I had a friend of mine that came. She was pissed off because she went to the emergency room because she had stomach pain. And she said, well, I went in there. I was there for 4 hours. They ran all of these tests, and then they came back and said, well, we'll let you know. I'm like, okay, well, what did you say to them? I told them I had stomach pain. That's it. I'm like, so they're not magicians, right? Like if you go in and you say, I have, essentially it's pain of unknown origin. So in order to find the origin, they're going to have to run tests. That's why they ask you those crazy things like, how long has it been? what's the
Right.
pain scale, stuff like that. And in order to find out what's wrong, they're going to have to do all these tests because you're not giving them any information. If you give them the information they need, you may not have to run that test. And he's like, I'm like, well, do you know when it started? She goes, well, yeah. You know what like caused it? And she goes, well, I have a pretty good idea. Well, did you tell him that? Well, no. Okay, well, that's why you had to have the tests.
Yeah, I feel like the opposite of advice you give about cops, you should give about doctors. Like you should be overly sharing with doctors.
Oh yeah.
Yeah.
100%. And like now I've worked in healthcare my entire career, so I was like 26 years this year. And
Congrats.
no, very few, I won't say everyone, but there are very few people who go into patient care for the sole purpose of fucking you over. Like they don't wake up in the morning and go, God, how can I screw my patients over today? Now, are there some?
Right.
Yes, but there are some in any profession.
There's a really small amount of jackasses anywhere you go.
Yeah. But I can assure you, most of them, they don't know what's happening either. Like they're just trying to be a clinician. Like I'm just trying to help my patient. I'm getting a phone call from this and I got to prior off this thing and I'm required to give this form. I don't even know what this form means. I spend probably at least half of my time in any given day educating our healthcare professionals just on the regulations. And like, this is what this form means. Like, this is why you have to give this form. This is why it's important for you to give this form. So I teach the actual healthcare professionals about healthcare,
Yeah.
but nobody teaches the patient how to be a patient, which I think it's a disservice, obviously.
You could
Because
start.
another thing, that would be hard. But like another thing I tell people all the time is there's like little tidbits of information. This is clippable too, Vicky. If you get a hospital bill and you don't agree with it, call them up. First off, don't pay your bill right away. I never pay a bill before 30 days. They have not sent it to insurance yet. It's just been sitting in a queue. If you overpay, I can assure you they are not going to give you your money back. So just wait on it. And I always, if I get a bill and it's one of those huge itemized ones and you're like, I don't know what the hell is on here, I can't read it. Ask for a coding review. Say, can I have a coding review on this? Make sure it's correct. Because the chances that somebody screwed that up are pretty significant because they're coding it based off of the physician's notes.
Oh.
So if you have an office visit for your eye, there's a CPT code for that. So the coder goes through the office notes. They go, okay, well, this fits into this one, so this is the code I'm going to use. And they put those codes in there, and that's how they bill it. But they're not always right.
I feel like something like this could have the air of subjectivity taken out of it.
It is. It is slowly having that taken out of it. However,
I guess there's good and bads to that, though.
There is good and bad. There's very few like governing regulations when it comes to AI in healthcare, which is crazy to me. Very, very, very little regulations. So a lot of hospital facilities or healthcare facilities are either like gung ho, like we're doing all AI all the time. Everything's great. We're going to replace our staff. Everything's AI all the time. And then you've got healthcare systems that are like, maybe not everything. Maybe just kind of bring it back a little bit because I went to a healthcare enforcement conference in Arlington, Virginia a couple years ago, and the Department of Justice was there talking about like their problem right now is who's responsible? Is it the company that built the AI or is it the facility that trained it? So there's a lot of nuance to it, but it never hurts. I mean, I always like tell everybody just ask for a coding review. It's not going to work every time, but I've had I got a stupid high bill for something once. I called in like, I need somebody to review this because this does not seem right. I just went in for like a normal visit and I have this huge bill and they coded it wrong.
Wouldn't have thought to do that either.
Yeah, most people don't. Most hospitals have patient advocates too. So if you don't agree with something, you can ask for an advocate. I want one of your patient advocates. I want to talk to somebody. They don't advertise those either. But yeah, it is an interesting and disturbing area. I do wish more people knew about it.
Yeah, no. I've already sent a text to my family group chat. So you guys heard about that?
Well, I mean, hey, if people have questions, I am a nerd for this stuff. I love this shit. I have a lot of people will come and ask me, but I love Medicare, which is crazy. So a lot of people will come and ask me like, I'm getting ready to, retire and I'm going to be 65. Like what do I do? Do I get like Medicare or Medicare Advantage? And I'm like, I don't know. It depends on what, are you chronically ill? Do you like to travel? Do you like, there's lots of stuff that goes into it.
Right.
And then also that Medicare Advantage is not Medicare. It's a private insurance company that contracted with Medicare for a certain amount of money. So like, what's a big one? Humana. We'll say Humana. So like Humana says, hey, I'll take care of Ben. I'll do it. Medicare and Medicare is okay, but can you do it for $500 a day? And I was like, hell yeah, I can do it for $500 a day. So they're going to sign you up,
Mhm.
and then you're going to get a bunch of care, and you're going to start chipping into that $500. And then they're going to go, we need a prior auth. And then there's no medical necessity. It's denied. Can't have it. And then they keep that share of the excess. I'm not a huge fan of Medicare Advantage.
I'll just say that sounds predatory almost.
It is. They actually just passed a bunch of new laws in 2026 to stop that because of the prior auths were getting ridiculous.
Yeah.
They're still going to be there. They're still going to do them, but I think they had, what did they say? They did a study, and one of them had, I want to say Aetna. This could not be, that could be incorrect, but one of them had like a 70% denial rating for their prior auths. It was insane. So they're like, yeah, no more of that.
Like, what is going through the C-suite of insurance companies if they're not in the business of helping people? Like, if they have that high of a denial rate, like, you're just in the business of stealing people's monies.
Yes, which is, I don't know how it's legal.
Yeah,
but essentially that is what they're doing.
So my favorite game is Mario Kart. He has his brother named Luigi.
Do not condone any of this.
We're talking about Mario Kart.
No, but it's crazy though, because I think we've been so conditioned as a society that this is what you have to do, right? You have to have health insurance. You have to pay a ridiculous amount of money for it. And then you just have to be okay with it when it doesn't work for you.
Right.
Which is not true at all. I personally, this is me, personally doesn't affect anybody else. I see they're called what's called a direct care provider.
Okay.
So I pay a monthly subscription for my physician, and
That's a thing?
Yeah. And so of course you don't know about it because nobody does. So I pay a monthly subscription, but I have access to my provider via text message, and I don't have to pay office visits. So any office visit, I could literally see her every day in the month, and it's not going to cost me any more than my subscription. They get their labs and stuff for cost because they're an organization. So this is sad. This is super sad. So the labs that I get through them were run through the organization that I actually work for.
Okay.
I got cheaper labs going through my other provider at cost. But so it's not replacing insurance, right? Because they don't do emergency care, they don't do surgery, they don't do stuff like that. But the thought process behind it is if you had access to your provider, then you could have preventative care. You could maybe not, like I can use them as an urgent care if I need to, and prevent those ER visits, and then prevent those, chronic diseases or those surgeries or stuff that you have to have later. So some people will just get like a super high deductible plan. Like I have a really high deductible plan, and then I just don't ever use it. I just throw the money into my HSA and then go see my direct care provider, so that if I ever do have to have a big surgery or an emergency, the HSA covers that deductible.
The closest one. Oh, Indian Living. That's like right there. Hell yeah. I think I just got a new doctor.
That is something that I have my kids on as well, so that if I continue to pay for their subscription, they can have access to their doctor, and not have to worry about stuff while they're trying to get, trying to be adults and trying to do other stuff. They can still stay on insurance, but actually have access to a doctor and be able to go. Because that's how most people get so bad, is that they hate the healthcare system. They don't understand how it works, and they're just tired of being rushed through. Like my appointments, I would say minimum is a half an hour. Wow. And I was just there last week and it was an hour.
Yeah, I was about to say, it's like living in like the part of Florida that I'm in, just finding a doctor that was willing to take on new patients has been a nightmare. Like I effectively just have to like live in like walk-in clinics for like primary care.
Oh, wow. Yeah, I don't know I am a huge advocate for it. Like I know at first people are like, well, I don't know if I want to pay a monthly subscription for it. I'm like, okay, well, I did the same thing. Yeah. And then I went and saw my primary care provider and got a $200 bill for the office visit. And that was just to see them so that they could refer me to other people so that I could get more bills and more stuff. So I'm like, I don't know, to me, it's worth it. So there's always an alternative. The other alternative is that you do not have to have your services sent to insurance. You can just say, I want to pay cash. And then they will, most of the time, most healthcare organizations will actually have a cash discount, and it's just cheaper.
The things I don't want you to know.
Yeah, there's all kinds of little tidbits of it.
Who brought this up? Someone named Vicky?
Yeah, Vicky.
Vicky, thank you. I just learned so much today, and I would have never learned this.
Yes, thank you, Vicky. Yeah, like I said, I was ranting about something else. I think I was giving him like a content update or something like that. And then I was like,
Yeah.
I just saw this stupid TikTok. And like, it pisses me off when people don't know, or I should say, pisses me off that people don't know. I know they don't know that they don't know this stuff because everybody should know it. There should be some kind of a healthcare literacy course or something. There's some of the largest financial decisions you'll ever make are healthcare
Yes.
related.
I was about to say in high school, I was taught like how to file taxes, how to apply and shop for mortgages and car loans. Why was I taught fuck all about the healthcare system?
Right? Exactly. And I'm pretty sure that it's like healthcare is one of like the top 3, top 5 expenses for Americans, period.
It's got to be top 3, right?
Yeah, it's like housing, transportation, and healthcare.
Yeah. And I would say for a lot of people, healthcare might even be like the most expensive thing.
Oh my gosh, if you have a chronic
Yeah.
illness, yeah.
And that's not going to be like an insignificant portion of the population either, because that's going to change as you get older too. So like, depending on where you're at in your life, like,
Yeah. Yeah, I don't know. I do feel for people who have chronic conditions because that's the stuff that's crazy. And that, used to hear like these horror stories about insulin costing, $1,000. And it's like, that's not like a Tylenol.
No.
One of the other areas that I work in is it's called consolidated billing. But essentially for nursing homes, when you're in a Part A stay or when Medicare Part A is paying for your nursing home stay, the nursing home is responsible to pay for all of that care and treatment that comes into it. So I get to be the one that goes over and answers the questions of, can we accept this person because they have a chemo med? And if we accept the chemo person, we have to accept the chemo med. All right, well, let's see how much the chemo med is. Some of those, I mean, I've seen medications that are $100,000 a month.
I think what doesn't sit right with me about that is that a lot of the R&D for pharmacology in general is funded through taxpayer funded grants.
Mm-hmm.
So I personally can't get on board with why are we funding the development of this drug and then continuing to pay these large premiums for it. Like, I'm not saying you can't profit off of a drug that you are administering and giving,
Right.
but you largely offset the cost of that development from money that I've already paid. Why are you now charging me an exorbitant
Well, and there's a difference between marking it up to cover costs and even to cover salaries and such, right?
Right. Yeah.
But I don't know what the justification would be to mark up a $10 medication to $100,000.
Yeah. Like if it costs you $10 to produce, that's your entire fringe, overhead, salaries, labor, materials, everything. Okay, cool. You could even charge me $20 for that, and I would probably be like, fair. 1,000? Come on, what are we doing?
Right? It's insane, and I don't know, and it pisses me off when these are, again, they're not like,
You're the right.
they're not like a comfort thing. You know what I mean? Like a lot of this stuff it's life-saving. It's treatment. It's, cancer treatments. It's all this other stuff. And it's like, well, yeah, but it costs so much to research and to do all. No, it did not. I know that because they actually list the, I think it's called the APC, the average pharmacy cost. I can't remember, but they actually list the price of it.
Yeah. And even if it did cost a lot to develop, most of that was on some sort of like research medical grant, probably funded through like NHS. So
yeah, that's dumb.
Yeah, that's
just kind of got a little off course.
That's okay. Though. I liked where it went today.
I'm not mad about it at all.
Yeah.
Maybe maybe we'll talk more about healthcare and the shitty system it is. I'm not anti-healthcare, right? Like we need healthcare. Our healthcare system is broken, but it's not useful. I know that doesn't make sense, but when it comes to providers, when it comes to clinicians, when it comes to people working in the healthcare, it's not their fault. It's especially not the person that answers the phone. It is not their fault.
Yeah.
They make $15 an hour and they don't deserve to be yelled at because your bill is crazy, which you have the right to be frustrated about. But that person had nothing. So like I said, most people that work in healthcare are not out to screw you over.
No, I don't think anyone is anywhere. Like even in my work, people are constantly like, "Oh, like, you scientists just." I'm just like, dude, I spend the vast majority of my day trying to teach a like 22-year-old master's student what a null hypothesis is. Like, you think I'm involved in some large conspiracy about like the moon? I'm trying to get this person to use the right word in a sentence. Like, like I was on this paper that we just submitted for publication. It was like one of the things I was like freaking out about for why I couldn't record. But my one co-author on the paper didn't understand the difference between diurnal and diel. And we were talking about like oxygen cycling over a 24-hour period, and he kept calling it the diurnal frequency. I was like, diurnal is just the opposite of nocturnal. You were talking about like a full 24-hour cycle. That's a deal. And like the arguments we had, like that is 99% of science is arguing over a singular word. And it's just like, we don't get along enough to get a
conspire.
conspiracy. Yeah. Like legit, if you know anyone in science or academia, we hate the rest of our field. like
My field is typically legal, so I usually work in the
yeah,
legal part of it, but we do have research science.
yeah.
And one of my coworkers a few years ago was a specialist in the research science, specifically animal research.
Okay.
And I was like, I don't like your tone talking about sciencey stuff on the animals. And she schooled the shit out of me on
Yeah.
animal research. She's like, it is more regulated than human research.
Correct. Yes.
She's like, it is so much more regulated because the patients
Yeah.
can't tell you anything.
Right.
So they have like pigs for some of the pig studies, whatever. She goes, we buy them iPads because they have the intelligence of a toddler. And she goes, we have to buy them iPads because you have to give them enrichment that is
Right.
equal to their capacity. I was like, damn, I did not know that. She goes, yeah, those fucking animals are treated better than we are. I was like, oh, okay.
Yeah, it's
I'll put my sign away now.
yeah, and it's even for like the research I do that it doesn't really involve like animal studies or human studies, I still have to present all of my research if it is funded on a grant that went through the university. Like most of my grants are from like the Florida Department of Environmental Protection or the Florida Department of Agriculture. But since they get brought into the university, all of my studies that I proposed and got accepted by the funding agency still have to pass my university's ethics board. And I'm just like, dude, like I'm not like mustard gassing people. I'm
Okay, maybe a little bit, but
like I'm testing like the processing of algae. Like like I'm just trying to make that more efficient. Like that's it has nothing to do with anybody. Yeah.
I have heard that the research boards are thorough, maybe. I don't know if that's the right word. Very, very you must defend what you're doing with some effort.
Yeah. And sometimes it's like it's some of the like worst people I've ever met. And they're like, ooh, I don't know if this is ethical. I'm just like, please shut up. Like I watch you
ethics.
I watch you knock a touring student's ice cream cone over yesterday. Like that wasn't ethical.
Nope,
No.
not now.
But I think it's more important for certain fields. Like I could understand if you're doing medical research, psychological research, or research on animals. I don't fully understand why I, as someone who grows algae, most of the time, and I'm like turning that algae into like fertilizer or biofuel, biodiesel mostly. And I'm testing the safety on that based to like EPA and like FDA standards, depending on like the actual use case for the product I'm trying to make at that point in time in that study. I don't understand why I need to go talk to an ethics board about this. Like, I don't know.
Right, yeah.
Yeah.
Like what's the ethical issue?
I don't know.
Right, yeah.
Yeah, and I'm just like, you guys, like, not trying to be a dick, but you're not qualified to check my study design because none of you are in my field. So, like, that changes. But I'm like, I like literally have no impact. So most of the time, I just go in and say I have like no impact on like the things they're looking for, and they're like, okay, cool. But sometimes they're like, oh, talk to me about it. I'm like, no, I don't have time for this today.
I don't want to.
Yeah,
So dumb. That's crazy.
the woes of science.
Right. Cool. Like I'm glad it's there.
Yeah.
Like definitely
Frustrating. Should be there. Still pisses me off.
right. And the regulatory, even though it is I have a love-hate with it. I love regulatory policy, but I also hate regulatory policy because it's like obviously we need curbs and gutters, we need checks and balances, we need things in place to keep people safe and to keep everything safe. Right. But like, my God, like this is insane. They have some new policies coming out for enrollment. So like everybody that gets federal money, they have to be enrolled in a program, in the Medicare program, in order to do it. So they have these really very strict rules and stuff that you have to do to be even able to participate in the program. And then if you're participating in the program, then you can get paid. So you have to do the conditions of participation and the conditions of payment. And they are coming out with some new rules that if you screw up the tiniest little thing, they can revoke your ability to participate in the program. And it's like for a clerical error. So like a clerical error thing. So like not even a quality of care issue, like not even an actual patient issue.
Yeah.
It's like you screwed up an address. And I'm like, I feel like that's extreme. I don't know that we need to do that, but it's all stemmed from the, and not getting political, but it does all stem from the whole like fraud. Like I think it started with Minnesota. Minnesota is fraudulating everything. And so we have to like pick on everybody. And then California is doing it and whatever. And then our CMS is run by a talk show host. which is crazy. I was talking to somebody the other day. I'm like, I don't know that I've ever seen the head of CMS on the news or on the TV so much as I have the last couple of years, which is, I mean, it is what it is, but yeah, it seems more to be for the headline at this point.
I think that's what a lot of it's for.
I'm like, I'm hoping that a lot of it doesn't actually go through.
Yeah.
It's more of just, this is what we're proposing to do. And we won't be ridiculous about it. But there was in California, I think in 2025, they busted a hospice fraud ring. $257 million in fraudulent claims.
Business.
Oh shit, right? And I'm like, so now everything's under, everything's under a bunch of scrutiny right now or whatever. And I'm like, I have a question. Like, should providers not do fraud? Yes, providers should not do fraud. It's not good. Why was it so easy to just create a hospice? Like,
dude, the same thing with like the fucking.
Did nobody?
It was like childcare in Minnesota specifically,
Yeah.
right? Why is it so easy to just up childcare? Like, I feel like that's objectively should be one of the most regulated industries. I know it's a huge need. We need childcare,
right?
But also, like, that is such a vulnerable demographic. Why can anyone just open like, hey, I'll have kids in my house? No, I don't think you should.
Right. There should be something in place.
Yeah.
Well, and it's like just like a hospice agency, like they're getting paid from the government. Like the government is paying them. You didn't think to maybe stop in and make sure they're legit?
Where's all the people?
Like people were buying the bad people were buying like Medicare beneficiary MBI's Medicare beneficiary numbers off of the dark web and like, creating patients. And it's like there had to have been a sign. There had to have been some kind of a red flag that you just chose to ignore until it got too bad. And now like we all have to pay for it.
Right. Like, I don't know, maybe if we just enforce some rules early on.
Yeah. Like I mean, we're in the process of just trying to like update a form. We're already enrolled, legit business, been a legit business for a very long time. And we just need to update a form. And it's practically an act of Congress to get it updated. I'm like, how do you just start a hospice? You just walk in one day and say, here, I'm going to start a hospice.
You just put a sign on the side of the road. Hey guys, open for business.
Right. I did. Honestly, they did. They like went around. They went around to different like nursing homes and whatever, and like sat down with beneficiaries and was like, "Hey, do you want to be on hospice?" And they're like, "Sure, I'll be on hospice." Signed them up for hospice, and then just started charging for services that they never provided. That is essentially what they did.
That's insane.
But yet, you can't. Like I said, you can't even change a form without having to call the government and be on some kind of a Zoom meeting with them. But you can open a hospice just fine. I think the other thing we did, I guess since we're on the subject of fraud, so durable medical equipment, things like wheelchairs, arm slings, like canes, walkers, that type of stuff. When I was at that conference a couple years ago, I was talking to one of the Department of Justice agents, and they were talking about how they got there was this huge increase in bills for like a knee brace to Medicare beneficiaries. And they were like, well, what the hell? What the hell's happening with this knee brace business? So looking around, they found a couple things that they thought were fraudulent. And they're like, okay, well, we're going to go. They're like, we actually showed up to the beneficiary's home. So like, about imagine being this like 90-year-old woman and the Department of Justice is showing up to your house because you committed fraud. And they walk in, we were talking to this lady and we're like, did you order a knee brace? She was like, no, I don't have a knee brace. I don't even have knee problems. What the hell? And so they figured out that what happened is that the scammers or the fraud people called at one point and said, hey, do you want to buy a knee brace and charge it to Medicare? And she was like, no, I don't need a knee brace. They're like, okay, sounds good. Well, they sampled her voice and then used AI to create a call from her requesting this knee brace and that it be charged to her Medicare. And so this is what they were doing to, I mean, it was ended up being like some I want to say like $60 million. It was some crazy amount of money that they ended up scamming. Like, this is why we can't have nice things.
Also, if you're that intelligent,
I literally said the same thing. Like, if you use your powers for good,
you're going to be fucking successful.
Right. Like, use your powers for good. Like that. They've stolen physician like NPI. So every provider has like an NPI number, which is like their provider social security number. It links them to get paid and all that other stuff. So people were stealing providers' NPIs and just like full on creating office visits and ordering stuff and getting it paid. And providers had no idea what was happening. They would end up having like the FBI show up at their clinic and are like, you just billed, like one of them, the FBI show up and said that they had billed $20 million in fraudulent claims. And the person had no idea.
Again, you'd be successful if you just did something else that wasn't illegal.
Just the legal stuff, you'd be good.
Just at that rate, you'd probably be pretty good at peddling Temu shit on TikTok. Just do that,
right? Just create some drop shipping stuff. You'll be fine.
Yeah. That shit pisses me off, but at least it's not illegal. Boy.
Yeah, the whole thing is nuts. I'm actually doing I think it's in September. There's a conference for this national organization that we're a part of, and I'm doing a presentation at the conference on fraud, waste, and abuse. So we're just getting some like statistics, like hit them right away because it's a conference about fraud. Most people are going to be asleep by the time they get to us. So I'm like, oh, let's get some like shocking statistics, right, and get them in there. And there was like, I think they said in 2025, I think the OIG or the Office of Inspector General and the Health and Human Services said they got like 200 some million dollars that they prevented. It was preventative fraud. So like 200 and some million dollars of preventative fraud just in 2025.
I don't understand.
I keep saying don't do fraud, kids, but it can be pretty lucrative.
Yeah.
It's a lucrative business.
Clearly, yeah. Gotta scheme something up, I guess.
Right? You gotta pick something.
Yeah.
So we're already an hour in. Do we want to continue this or go on to our topic or do the topic another day?
I feel like this is a good standalone episode. It's a bit
Yeah,
different than what we expected, but I think this is
truthfully,
fun.
I'm happy with it. I was just sitting here like, man, I'm happy with the way this went. And it's funny because like I was sitting here thinking, oh crap, I don't want to, like, I'll just do this really quick thing at the beginning, right? For this like little clip for Vicky.
Yeah.
I think like healthcare, I think could be like a standing, like
Yeah.
every now and then just come back and like, you want to hear some shit? This just went down.
No, I think that'd be really interesting. Yeah. And honestly, I feel like making this its own thing probably even better because I feel like it's a really important topic and I don't want to take away from it by doing something else with it. So
Yeah, I agree. Well, we'll see what the people think. If you guys like healthcare stuff and you want to know more about it, trust me, I am more than willing to talk about it. Most people don't want to listen to me talk about it, so there you go. It's even better when people do.
I think this is really interesting. Yeah. Yeah. I feel like we should just start interjecting healthcare episodes from time to time.
I'm fine with it. I'm all about requests too. I would be curious. I don't know how disturbingly interesting the research world is, but I would be. We should do an episode one time on like just the like evolution of research study because some of that shit got pretty weird.
Yeah.
For like a long time before they stepped in and were like,
particularly
maybe we should not do that.
like psychology in general, the things they got away with before institutional review boards. Crazy.
Yeah. But awesome. It's been good. We'll see you next time. I suppose I don't want to do an outro. Like, goodbye, everybody. Hey, you got to do toodles.
Toodles.
Doodles.